Hi, Tracy Tyson. I'm a pediatrician in Vermont, and I wanted to talk about what are things you can do if someone you know or love is struggling with their mental health and feeling suicidal. First thing to be is acknowledge with the person that you understand how they're feeling. Try not to have judgment if you can help it. It is a feeling, it is a normal human emotion, and it means that the person has been struggling longer with their mental health than maybe you have realized. So try to be non-judgmental, ask how you can help. If they don't immediately offer ways that you can help, there are things you can do to help keep them safe. The first thing is recognizing in the United States, we have a crisis line that is like 911, it's 988. If you need help trying to figure out how to support someone you know and love with their mental health, you can call, or you can offer them the number if they need to talk to someone. Anyone can call this number and get close to immediate help by a mental health professional or someone trained to screen for mental health disorders in the United States. It is completely free to use. They are not sending the police to your house unless you tell them you are going to harm yourself. They are not going to call DCF. It is just a option for families to have some immediate help from someone who is trained to support them, because as we know, even though emergency rooms end up being where a lot of people go who are struggling with their mental health, it is extremely traumatizing, it's not helpful, and so often it ends up making things worse. So making sure that that person knows how to call crisis and that you yourself also know how to call crisis, and using the 988. This will even get you to your local crisis number so it can replace any other number that you have. The second thing is to come up with a realistic safety plan. Doing this with a crisis worker is actually going to be the most helpful, but like we also do them in our pediatric office, our mental health counselors do them. So making a safety plan with someone who understands what to be looking for is really helpful. Things you want to be careful of is medications, things that are sharp, knives, razor blades, and also any access to guns or weapons. And there's ways that you can do that to keep them safe. Each state has different laws about what is available. Here in Vermont, even though we know we need stronger, we have really good laws in place for mental health where someone can take their weapons to be stored for a certain period of time if they themselves or someone in their home is struggling with mental health, so that they can also call, and the local police department, not a crime, is going to come take the weapons and store them for you if that person is not willing to give them up themselves, in order to keep them safe while they are getting evaluated for their mental health. So coming up with that safety plan is absolutely extremely important. Everyone that's caring for the person needs to agree to this and adhere to this, and please seek support from someone who is trained to help you with them, because it's not always that simple to do. The next thing is, so calling crisis, getting a safety plan in place, reaching out to your medical provider. This is getting better. I think more people are realizing that we are the place to go. People used to just try to call a counselor and they just went straight to counseling and didn't think to call their medical provider. If you have a counselor that you know and you want to start in that direction, totally appropriate. That's one of the first things we're going to do anyway. However, we do have screening to make sure that the person is safe and not in medical crisis a little bit sooner. So always loop in your primary care provider. Take the child to the pediatrician. If it's an adult, to ask to support them. Can I drive you? Can I take you to try to go get them help? In the pediatrician's office, we do some screening tools to see, is there clinical depression and anxiety? If there is clinical depression and the person is reporting symptoms of self-harm and or suicide, we will do more in-depth screening with them. These can feel really uncomfortable as a parent and then also the patient. But I want to remind everyone, talking about mental health doesn't make it happen. And talking about suicide does not put the thought in the person's brain. It is already happening by the time you started talking about it. Talking about it helps get it out. And actually studies show the opposite. The more we talk about it, the more we are upfront about it, the less likely the person is to harm themselves. So if we're looking at risks here, we need to talk about it often, and get help as quickly as possible. So calling us in the pediatrician's office. In my office, we have nurses who are trained to screen for mental health conditions over the phone. We usually can get you in relatively quickly. The goal is not same day in a primary care office, because again, we're not crisis counselors. We would need to see you within 3 days to a week as you're going through crisis and safety plans and all of these things. Once we see you, we can talk about if there is any medical intervention that needs to take place, always with the parents' input as shared decision making, also with the patients, shared decision making is involved, medication isn't always necessary, but it should always be considered. Counseling is not always, or is the patient willing to go, but should always be considered. We just, again, like shared decision making, so we don't want to put more trauma on the person by forcing counseling in this situation. So being upfront, talking about things, being very clear, coming up with a safety plan, know the laws in your state, especially related to guns and suicide, talking to your primary care provider, being open about treatment options, being open with your child about their feelings and emotions, and calling crisis if needed. I hope this helps. If someone you know is struggling, again, please call 988, and also we can go to your Department of Health website, and there's a lot more information as well so that you can see what is available in your state and what are the quickest ways to get support. Take care.